Hi everyone, my name is Eliza, and today me and my group are going to be talking about the prevalence of MERS-CoV, also known as the Middle East Respiratory Syndrome coronavirus, among persons in Saudi Arabia from 2012 to 2015. So I'm going to be talking to you guys about areas for further epidemiologic research, as well as why our group deserves to win the $100 million. To start off, the pattern of disease transmission is an area that can be used for further epidemiologic research. Further research in zoonotic sources of infection is needed in order to determine possible host and environmental sources that can act as modes of transmission. Areas such as evaluating patients, case definitions, travel guidance, and infection control are areas that should be used for further epidemiologic research as well. In evaluating patients, healthcare providers should continue evaluating patients for MERS-CoV, especially if they develop similar symptoms within 14 days of traveling from the Arabian Peninsula. Infection control is one of the most important areas that need further epidemiologic research because patients with the virus should remain in isolation until they can be said to no longer be contagious. The understanding of the disease can be transmitted through the contact with camels, drinking raw milk, and bad hygiene overall, which needs to be further analyzed in order for people to completely understand the extent of being able to contract MERS-CoV. Since a typical healthcare setting is where most of these cases occur, researchers should be prudent to ensure safer, cleaner, and appropriate measures when handling patients. Epidemiologists and researchers should address the differences in symptoms between cases, along with digging deeper in order to find a more sufficient cure. It is difficult to find a cure to a virus where healthcare professionals are still lacking in evidence. With that being said, epidemiologists and researchers should also be able to educate others about MERS-CoV in order for more people to be aware and follow certain prevention methods so that the number of cases of MERS-CoV can be reduced until a successful vaccine is found. Looking at the chart above, it shows MERS-CoV detections per day from April 20th to July 14th of 2014. Its highest peak seems to be at April 21st of 2014, and it starts to become steady beginning May 30th all the way to July 14th. With that being said, to have every day have a different number of cases is exactly why further epidemiologic research is needed. Why our group deserves to win the $100 million is to be able to fund research in order to find a treatment for MERS-CoV without just being able to use treatment to treat symptoms, but to cure it as a whole. The $100 million could also be helpful in the aspect of being able to find a successful vaccine, like the flu vaccine, for example, to prevent people from contracting MERS. Vaccines that have been found through funding have become successful in preventing certain diseases and viruses in all ages. Some examples are vaccinations for measles, chickenpox, hepatitis B, meningitis, pneumonia, and so many more. All have been amazing in strengthening immunization nationwide. We also deserve the money in order for us to reference for future research studies. Numbers, cases of people infected or showing symptoms of MERS change over a period of time, and further research for future is needed in order to become more prepared for another outbreak from occurring. With that being said, that concludes my presentation on areas for further epidemiologic research, as well as why we deserve to win the $100 million.